Good evening, ladies and gentlemen. My name is Okorochi Malvis. I want to talk to you about peptic ulcer disease, also known as acid peptic disease, or best known as peptic ulcer or ulcer, depending on the parlance. Now, by way of introduction, peptic ulcer is a common health problem in Nigeria with an estimated prevalence of 10 to 22% of the population being affected. The high prevalence being as a result of certain factors like 1. Injudicious or overzealous use of non-steroidal anti-inflammatory drugs, also known as NSAIDs, use of corticosteroids, and H. pylori infection, that's Helicobacter pylori. It's a bacteria, a gram-negative rod. And then there is poor sanitation and hygiene, and then lack of access to quality health care makes it difficult for people to access healthcare. Above definition, peptic ulcer occurs when there is a breach in the mucosal lining of the gastrointestinal tract, being either the stomach or the duodenum. Now, when this breach is to the tone of less than 5 millimeters, it is seen as an erosion. But when it's more than 5 millimeters, it is seen as an ulcer. Now, in simple terms, it can just be seen as the occurrence of sore on the lining, mucosal lining of the stomach and duodenum or intestine, which can cause pain or discomfort. Now let's look at the causes of this peptic ulcer. Number 1 in the list is H. pylori infection. So H. pylori is a gram-negative organism which colonizes in the antrum of the stomach. It stays in the stomach, but then in the stomach there's acid production. But how you may wonder how this organism gets to survive inside the stomach that still has a good amount of acid production. But then it does survive by the help of its enzyme. It has an enzyme known as urease. This enzyme helps to break down urea into ammonia and CO2, carbon dioxide. So the ammonia is, of course, an alkaline, which creates an alkaline environment around it, therefore helping it to survive and cope with the acidic environment. So it's more like it creates an alcoholic or an alkaline environment around it that neutralizes the effects of the acid, therefore cushioning the effect of the acid and then allowing it to thrive and burrow further into the intestinal mucosa and intestinal wall. So number 2 cause is the drugs known as the NSAIDs, standing for non-steroidal anti-inflammatory drugs. Now, this, from the name, non-steroidal anti-inflammatory drug, is a non-steroidal drug that is used for pain and inflammation. It's used for treating pain and inflammation. Good thing is that it does the right thing. It has a good role, a good function, which is to help stop pain and inflammation. But on the other side, it irritates the mucosal lining of the stomach and intestine, therefore causing this peptic ulcer. So examples of such drugs are we have diclofenac, we have ibuprofen, we have naproxen, we have aspirin, and the rest of them. There's so many. All these drugs shouldn't be used for a long time, because over time they begin to disrupt the mucosal lining and then lead to ulcer. They destroy the mucosal barrier, the protective barrier within it's more like when you have when you have on the lining a protective surface or cover, and then something is going to destroy that protective cover. So when that protective cover is being destroyed, you find out that it will be easy for certain chemicals, substances, organisms, to be able to penetrate in. So this is just the case of this NSAID and the gastric and intestinal mucosa. Next on the list for the causes is smoking. Now, smoking has been implicated in a number of diseases and conditions. Now, smoking in this case can be seen to erode the lining of the stomach and the intestine and still predispose to ulcer. As one of the causes of those conditions, like most cancers, you always see smoking. So there'll be like history of smoking, diabetes, hypertension. You see history of smoking, respiratory problems. You see history of smoking. You understand? So this smoking, they've been advising you against. Why don't you just stop it and rest? Like, find a way and stop it. I know it's not going to be easy for those ones that have been addicted. But for you that is still trying to, do it, why not stop it? Because even in this very condition we talked about, which is peptic ulcer, it's still indicated. It's still implicated. Let me use it. It's still implicated. Smoking is implicated, and then alcoholism as well. Some of you are so addicted to alcohol that you can't stay a day without taking at least 1 or 2 bottles of alcohol. That's not so nice, because there are, alcohol is just like smoking, is also implicated in various ailments, various medical conditions in the body. Alcohol and smoking are always there. You understand? So when you come to the hospital and they're taking your history, they're asking you questions. They always ask you, do you take alcohol? If you say yes, if you say no, then no problem. If you say yes, they now go further to ask you, how much volume do you take? Like, how can you quantify how much you take in a day, in a week? You try to, because there is an accepted amount of alcohol that a human being is supposed to take, like for men and women. Do you understand? So if you're exceeding these amounts, like, it's not so nice. You understand? Because it will predispose you to a whole lot of these non-communicable illnesses or non-communicable diseases. Like the ulcer we talked about. So most of you who drink excessively, you're at risk of peptic ulcer. And then the next one is stress. How do you manage stress? Like when you're so stressed out, you're working and working and overworking yourself. You've overworked your capacity and you're still working. That's stress. You understand? It will, if you keep doing something like that, you end up coming down with peptic ulcer. Yes. Like, how does it occur? When there is excess, when there is stress to the body, you see the body producing certain hormones that will help it, manage and cope with stress. Example of those hormones is cortisol. The cortisol about. Cortisol is a stress hormone. So when it's being produced, it also has a way of triggering or bringing about increased peptic acid secretion. So of course, when there's increased acid, because the whole essence of this topic is how to control acids. So acids now that's been secreted in quantum will still bring about ulcer. You understand? Stress ulcer. It's called this Collins ulcer. So that's for that. So what's our thing? So these are stuff you need to. And then very importantly, also you try to avoid excess, consumption of fatty foods. You take fries, you take foods that are rich in fats, cheese, butter, and the rest of them, granules, oils, and the rest of them. All those foods are not so nice because it also predisposes to not just ulcer, but a whole lot of medical conditions. You understand? A whole lot of a whole lot of a whole lot of conditions, basically. Let me just say, because we have coronary artery disease, we have myocardial infarction, we have stroke. It can produce stroke. Yes, because these are conditions that when you take a lot of fats, and then somehow you get the bad cholesterol, which is excessive, very low density and low density lipoproteins. You understand? And then you see them accumulating the blood vessels and then blocking certain areas like the heart, causing myocardial infarction, blocking the brain, the vessels supplying the brain, bringing about stroke and the rest of them. So these are things you need to know. You understand? So not just the ulcer, because this topic is not just while we're discussing ulcer, we're also trying to talk about other areas, like somehow, like how it gets to affect the other systems in the body, or how it gets to bring about pathology in various other systems, and cause them to break down and the rest of them. So the next one we're looking at is very importantly, also you shouldn't be seen taking too much of caffeinated foods. Caffeine, too much of caffeine. Well, either you're taking it in tea, you're taking coffee, you're taking tea itself, as beverage. In the morning you take bread and tea, in the night you're also taking tea again. There are sometimes in the afternoon you see people still taking tea, and then in the night you see people taking coffee, to help them stay awake in the night. You understand? Why are consuming all of these? Also remember that it has a side effect. You understand? Almost everything that has advantage has a disadvantage. So this one also has a very significant disadvantage, which is its ability to cause peptic ulcer disease. So these I'm are some of the ways or measures you can adopt to prevent the occurrence of peptic ulcer. At least do your own part. And then very importantly as well, when you get diagnosed of H. pylori infection, do well to get yourself treated of it, because it's one of it costs like 50% of peptic ulcer disease. You understand? It's implicated in about 50% of cases of peptic ulcer. So once you're diagnosed of peptic ulcer via stool, blood, or whatever, just try to get yourself treated from it. You understand? Anyway, your doctor should institute appropriate treatment and make sure it's well eradicated, because over time it's not just going to limit itself to causing you just ulcer. It's going to get progress. It's going to be progressive. From ulcer it will progress to metaplasia, which is changing of the epithelium of the stomach, and probably the at least barrel esophagus as well, and some other structures like the esophagus. You can also call from metaplasia to become dysplasia, which is change from a normal cell to an abnormal cell, which is tending towards mutation. Of course, that's mutation when it changes from its normal form and it's taking another form. Do you understand? So that's the dysplasia. It's taking the form of probably a cancer. So over time, it will not bring about full-blown cancer, which is gastrinoma. I'm sure you wouldn't want to come down with this. So once you notice that you are, you've been diagnosed of H. pylori, present in either your urine, your blood, or whatever, just do well to get yourself treated. So thank you, and then follow the page at the end. I will appreciate. I'm sure you must have enjoyed this video. Like, at the end of the day, just help us by liking the page and then share it to your friends as well, and then try to follow the page as well, so that you can be able to see subsequent posts. And so do well to follow the page. Okay, thank you, and see you in the next video.